AI, which is for internal purposes only, so we don't share that out. That just helps us with tracking conversation and keeping notes and things like that. If you need any closed captioning transcripts, anything like that, let us know. And while you're certainly not required to have your video on, we always like to see smiling faces on Friday morning. So, all right, next slide, Emily. So for our agenda for today, we just have a few updates, things that we want to make sure that is on your radar. We're also going to be doing a community spotlight. So Christopher O'Malley from the county is here to talk data. So he has a presentation that he'll be walking through in just a few minutes. And then after that, we're going to do a little activity. We're going to break out into a couple of breakout rooms. We're going to walk through the best practices playbook. So I know most of you, if not all of you, have seen it. We've had some conversations, but we want to make sure that we're continuing to move this forward. And so we're going to have a little time at the end to have some smaller discussions about what you like, what you may not like, and a few other questions that we'll get to as well. All right, Emily, next slide. And I think you can go one more, and then I think it's you, Denise.
Thank you so much. Okay, so we all know that DHCS has renamed CalAIM Medi-Cal Transformation. But we have a quick poll for you all mostly because I'm having a heck of the time finding resources. And every time I go to look for the thing that I was trying to look for, I can't locate it. And so just really quick, we wanted to do a pulse check. Are you all feeling comfortable accessing resources on the DHCS website or not? So quick poll on a scale of 1 to 5. And then as folks are answering that question, we'll give you a minute or two to respond. But the whole point of the question is, do we want to have a CalAIM Academy session, which is optional, and spend some time figuring out and talking through where to access resources? Might we want to spend more time in our monthly meetings, highlighting different resources that are available? And so just kind of doing a quick pulse check there. And as folks are responding, I think, Emily, can we move forward? We can keep moving forward, right?
I think the poll will be in everybody's faces. For those who have completed the poll, real quick, can you let me know if it closes out for you once you complete it?
It does.
It closes out. Yes, thank you. Oh, I love people who help me test things electronically. Thank you, guys.
Emily is very excited. I don't know if anybody is a Zoom fanatic, but Emily is very excited about some of the new Zoom features. So there you have it. Okay, we should be able to keep things moving forward, but Emily, did it go through each of the questions?
Yes, ma'am. It's the whole survey, basically. So all 4 or 5 questions, 4 questions are up there, and it will disappear from your faces, people, once you complete it. Thank you so much.
Thank you. Okay, a little bit more housekeeping before we get into it. Our community meetings and events, we're working on trying to get this document updated. So if you have updates to your meetings where you are the chair or these are your meetings, if you wouldn't mind either sharing with us a way for us to update the listing or to go in and update the listing yourself. Why does this exist? It exists to help all of us leverage meetings that are available and work groups that are available in the community and prevent us creating new meetings, and maximizing efficiency, obviously, limiting a number of new meetings being added to everybody's calendars. It also helps us leverage which meetings we can take different content to in order to advance different initiatives that we're working on. So anything you all can do to help us get this updated would be greatly appreciated. And then I'll pick on you, Cami, really quick. The CIE has just recently announced their annual conference. I think we have the 2023 one on this listing as well, so we can update that with 2024. And that's a save the date coming this summer, right?
Sorry, I was trying to get to unmute. Yes, it is June 24th through 26th. So if you haven't received the e-blast, feel free to shoot me your email, or you can visit the CIE website, ciesandiego.org, and register today. This year, it will be on campus at USD.
Thanks so much. And
Thanks,
we'll
Denise.
update this list as well. All right, great. Few more different bits of housekeeping. Emily, the next one I think is just to let everybody know, if you are looking at TA Marketplace, there is a vendor fair. So you can sign up right now. They just have registration open for the first event. We'll keep pushing things through Slack. So letting folks know when the new registration is available for the new events. But the vendor fair will talk through each of the domains, and it'll have all of the TA vendors do sort of a round robin on what services are available, and then go into breakout rooms to kind of discuss those services in more detail. So it's a nice opportunity, if it's something that you're considering, to kind of get that overview in each of the domains. Thanks, Cami, for that. We'll include that in our follow-up email as well. Okay, one more bit of update before handing things over to Christopher. HCS policy debriefs. So there have been a few things that came through in January and in February. The ECM policy guide was updated with a February 2024 date. So if anybody's interested in looking at any of those updates, we do have all of our links in this presentation. They're in the appendix, along with more detail for each of these policy debriefs from DHCS. So if there's something here that you're interested in, I'm not going to read through the slide. We just want to make sure that we're spending some time getting folks to the information that is updated as close to when it's updated as possible. We also push that content out in Slack, but if you're not a Slack user, we just want to make sure that we're flagging new updates. Okay, I think that's the last bit of housekeeping for us before handing things over to Christopher. Just making sure, Emily, if you could advance one more slide for me. Perfect. Okay, Christopher, I'm going to let you introduce yourself. I'm going to thank you again for spending the time talking with us today, and just kind of an intro to why you're here. I was fortunate enough to listen to you present in one of the HSD meetings. And, you know, we talk a lot in this collaborative about data. We actually have a data standardization work group. There are other work groups that have been in existence in the community for quite a while. But data is a real critical piece to the work that we're doing in the initiative around CalAIM. And so it's always helpful to know what data already exists when we're trying to look at things to incorporate into our measurement strategy. And as we're getting into the new year of 2024 and looking at our measurement strategy changes for the year, we wanted to kind of level set on some data that's already available in the community. And so with that, I'll hand things over to you to talk through some of this data in more detail.
Thank you, Denise. I guess I didn't know if it was going to advance into my slides, but I can introduce myself. My name is Chris O'Malley. I am the chief of the County of San Diego's Community Health Statistics Unit. And our unit is embedded within Public Health Services Administration. Just a little bit about myself before I get started here. Prior to my work at the county, I had been working at the Naval Health Research Center as a epidemiologist and data analyst. And then prior to being chief of my unit, I was also a county epidemiologist. And I lead a team of epidemiologists in the Community Health Statistics Unit. And then prior to my career in public health, I was in the United States Navy active duty. Next slide, please. So just a quick overview of what I'm going to present. Community Health Statistics Unit, I'm going to do a little just a little blurb about San Diego County for those who are just unfamiliar with certain topics and certain geographies, and then a little bit about what my unit, Community Health Statistics Unit, does, and then get into the data, health data, demographic data, mortality data, health equity data products that are available on our website, and then some products that are coming soon. I'm going to throw a link to our website here in the chat. Next slide, please. And so, as I said, welcome to San Diego. I'm sure many of us are familiar, but we are the second most populous county in California and the fifth most populous in the United States. San Diego has just over 3.3 million residents. And then we have the busiest land border crossing in the Western Hemisphere. So 1 out of every 13 people who enter the United States come through the San Ysidro land port of entry. We have the largest refugee resettlement site in California, and at a total area of 4,526 square miles, larger than Rhode Island and Delaware combined, as well as 70 miles of coastline. Next slide, please. So Community Health Statistics Unit. Now, for those of us that are very excited about the weekend and are just like going to tune me out for the next 30 minutes, the only thing I ask you to remember is sdhealthstatistics.com. If you remember anything from this presentation, that is our website. That is where you're going to be able to find all of this data and all of the data products. So sdhealthstatistics.com, and then I'll end my infomercial at right there. So what do we do? What does our unit do? We collect, organize, and analyze population health and well-being data, including demographic data, economic data, behavioral data, and then health outcomes data. We create visualizations using Tableau, including dashboards, develop projections and predictive models, perform economic analyses, including cost burden of various diseases, develop reports, briefs, talking points, and issue summaries. We give formal presentations as well as participate in work groups and are sometimes referred to as the data people. Next slide, please. So just kind of a little bit of a geography lesson, just real quick, in case I bring up some of these terms or you go to our website and you're unfamiliar with some of these terminologies. HHSA region is a geography we use to break up the county into 6 regions. You see there in the colors, central, east, north central, north coastal, north inland, and south. I get this question a lot. Regions are essentially aggregated zip codes. And then for number 2 on my list here, sub-regional area, those are smaller sub-regional areas within each of the regions. And those sub-regional areas, those are aggregated census tracts. And then we also have data on our website for the supervisorial districts in our county, as well as cities in our county and municipalities. And then demographic data on our website is available at the census tract level. Next slide. Next slide, please. So product cycle, just to kind of give you a quick overview, a lot of these products I'm going to review throughout the slides, but a great many of them are updated yearly, annually. So on the right, you can see a list there, and quite a few of those I'll go through in this presentation. And then some of our products are every other year. So products like our health equity briefs, those will be even years. Those will be coming out this year. And then a product such as our tribal brief, that would be odd years. So the next iteration of our tribal brief will be 2025. Next slide, please. So products currently available on the CHSU website. Oh, I get to hit you with this again. Don't forget, sdhealthstatistics.com. Next slide, please. Getting into our health data. Next slide, please. Our community profiles in Tableau. These are our health outcome data. And we have these available now as dynamic dashboards, but they're also available if you just want the actual data, the actual numbers. We still have that available as downloadable CSV files from our website. We have over 80 conditions and 6 outcomes, primary and any mentioned discharge diagnoses, diagnoses groups that we create. They align with the HCUP hospital and healthcare standards produced by AHRQ. And then these dashboards can visualize health data by the lenses of health equity. So if you're looking for data by age group, gender, geography, race, ethnicity, or socioeconomic status, and they're accessible online as an interactive tool. The nice thing about these dashboards and all of the dashboards that we create is that if you had a particular topic, say you were just interested in diabetes and you wanted a slide on diabetes, you can print it out as a PDF, as a PowerPoint slide or an image if you needed to use it for a presentation. Next slide,
Christopher,
please.
Really
Yes.
quick, Christopher, do you have data points that include justice involved?
Do we have data points that include justice involved population? Not currently, no, we do not.
Thank you.
Any plans to include that in the future, perhaps?
If it becomes available, if the data becomes available, yes, we would absolutely try to produce that, but it would be in an aggregated level. So it would probably be at the county level. Pretty much everything that we're going to put out is aggregated data. We're never going to put out any kind of rows of like discharges. Like, just to use this product as an example, like discharges are always going to be aggregated, and then we'll suppress small numbers for certain communities, because just thinking of some of our eastern communities and North Inland communities, like they have much smaller populations, so some of those rates, also those health rates, will be suppressed.
Thank you.
Next slide, please. Disease and injury atlases. So if some of these health data are of interest to you, or health outcomes, they're also available as static maps. I have a team of very excellent folks that know how to work with ArcGIS Pro. So we'll produce these static maps annually and put them up on the website. So if I'll just use diabetes again as an example, if you were just interested in diabetes in the older adult population and wanted to see a heat map and what that looked like for the county, you can go into our disease and injury atlases and boom, you have that map right at your disposal. And again, these are produced annually. Next slide, please. Morbidity dashboard. The 2021 morbidity dashboard displays the amount of disease among San Diego County residents, with morbidity defined as the sum of all inpatient and outpatient discharges. The thing I always like to point out with this dashboard, folks find this one as pretty interesting when they look at the map that's embedded in the dashboard, because it has urbanicity. So if folks were just wanted to look at like rural parts of the county and see how that differed with the rest of the county, this would kind of be your go-to product for that. Next slide, please. And moving into demographic data. Next slide again, please. Our demographic profiles is by far our most popular product and the most downloaded product in Health and Human Services. This is available at the HHSA and sub-regional area, so our regional levels and sub-regional area, Board of Supervisor District, city or municipality, and then it also has the unincorporated area levels. And this now we have a dashboard that has census track. This is a compilation of demographic characteristics of specific populations in San Diego County. And if folks on the call are familiar with the American Community Survey, essentially what we do is we take the American Community Survey data for San Diego and we put it in this really nice product for you. So for those who are really still into paper and just wouldn't touch a dashboard with like a 10-foot pole, you can print out the really pretty PDF. and you have that at your disposal. And then for those that are really just, hey, give me a dashboard, I don't want to print it, waste any more paper, we have that available to you as well. Many of these factors have been implicated at the roots of health disparities. This is designed to help HHSA staff in each of the Health and Human Services agency regions, the public health community, policymakers, and local organizations, including LiveWell San Diego recognized partners, identify and prioritize needs within their communities. So if you were interested in grandparents raising grandchildren, but you only wanted to know about what's going on with that in the East region, this would be your product. This would give you the percentages. Or if you were interested in a part of the county and you wanted to know what languages, what percent of a language being spoken in that part of the county was, this is your go-to document. So again, this is probably by far our most popular product. Although there's only one slide for demographics, we have a ton of demographic data on the website. But this is, again, like the go-to product for demographics. Next slide, please. Oh, I see there might be some questions in the chat too. Are there any costs associated with using the dashboard? Also, do you have APIs if we want to embed, integrate the dashboard? There's no cost associated. I'll have to get back to you on the APIs. But again, like I said, if you want to grab the image from a dashboard, you're free to publish off of those. Like you can print and publish parts of the dashboard as a slide for a presentation, or if you want to use it in something it's available for public use. Moving into mortality data. Next slide, please. So the community profiles that I had showed earlier, that includes some of our death data as well, mortality data, but it's mostly emergency department and hospitalization discharge data that we receive from the state. But I wanted to get into some of our mortality products just to kind of give you an idea of the other things that the unit's doing. One of the things that our unit is responsible for is we produce the annual life expectancy numbers for the county. And so life expectancy is one of the top 10 indicators measured for the county of San Diego's LiveWell San Diego vision for a healthier, safer, and thriving communities. And this measure is widely used indicator for capability to live a long and healthy life and reflects the overall mortality of the population. We have a life expectancy brief on our website, and we have annual life expectancy numbers available from 2010 to 2022. We have it available for gender, race, ethnicity, geography, and overall for the county. Just in case people were curious, San Diego County, we have a higher life expectancy than the state of California and a higher life expectancy than the United States. So kind of in layman's terms, essentially a baby born here is expected to live longer than a baby born elsewhere in California out of this county and in the United States outside of San Diego County. Next slide, please. Leading causes of death. We have our leading causes of death in San Diego County. This is available by year, gender, race, ethnicity, HSA region, supervisorial districts. We have a new product for this, leading causes of death by Asian Pacific Islander subgroup. This is a roll-up. So for that particular product, for the Pacific Islander subgroup, if you were just interested in San Diego County residents, leading cause of death for our Filipino San Diego County residents, you would go to that product, and it's a roll-up of 5 years of data. And then leading causes of death has been updated through the data year 2022. And usually if I say a year, I'm always referring to January through December. So the calendar year for data. Next slide, please. And just wanted to give you a snapshot from our leading causes of death dashboard, just to kind of give you an idea. Cancer is the leading cause of death in San Diego, whereas diseases of the heart is the leading cause of death in the United States. So we have a different leading cause of death in our county versus the United States. And then for those that are interested about overdose, because I get this question quite a bit, drug overdoses would be included in the accidents, unintentional injuries category. or the intentional self-harm suicide category. So they would be in, they would fall into either of those categories depending on intent. Next slide, please. 3450 chronic disease. For those unfamiliar with the term, this is 3 behaviors that lead to 4 diseases that results in over 50% of death in San Diego. So looking at our 3450 numbers, next slide, please. This is really actually like a positive story about the county in terms of chronic disease. We're trending down. We're doing really well. We are no longer, these diseases no longer make up 50%. The proportion of deaths due to 3450 chronic disease in San Diego County dropped from 63% back in 2000 to 44% in 2022. But despite a decrease, 3450 chronic disease still account for 44% of all deaths in San Diego County as of 2022 data year. And we have a great deal of products for this. So if you're just interested in chronic disease in certain parts of the county, a certain group, there's more than likely a product for that. We have a pretty big section on this. Next slide, please. Health equity data products. How am I doing on time, Denise? I'm okay.
You're doing good.
Okay. This is where it could take a little bit of time. So, next slide, please. And we're going to get into some of our health equity data products. The Health Equity Report Series, also an extremely popular product, but the unfortunate nature of this product was that they're very large. They're like over 80 pages. And they take a long time to get approvals for, and by the time we'd get them out, the data would be old. But they're still pretty useful. They provide, they are reports that provide health disparities by age, gender, geography, race, ethnicity, socioeconomic status, and then disease categories, including chronic disease, communicable, maternal and child health, injury, and behavioral health. But as I had said, they were extremely long, and they took a long time to kind of sort of get out the door. Our last ones were published in 2022, but they had 2017 data in them. So we have since moved to converting these into health equity briefs, and I'll talk about that more later in the presentation. Next slide, please. And just some high points, just to kind of, this is the kind of stuff that you can pull out of these reports if you're interested. In San Diego County, poor maternal and child health outcomes were higher among our Black residents. And then injury overall was higher among females, and then Black and white residents, or those age 65 and older, as well as residents in rural communities of the county. And then poor behavioral health outcomes were higher among males, rural communities, Black and white residents, and those age 25 to 44 years. Next slide, please. Our poverty dashboard series, we're very, very proud of this product. It's a series of 3 dashboards and accompanying briefs. I'll just get right into it. Next slide, please. I'll go through each one of them individually. So our first series, dashboard and brief series 1, which I believe was just updated this morning with newer data. But these dashboards and briefs include information for the county at the census tract level for areas of persistent poverty, historically disadvantaged communities in our in San Diego County, and in areas with low access to food. Next slide, please. And then for series 2, poverty series, brief and dashboard series 2 focuses on family and child poverty, deep poverty, housing, and employment. For those that are unfamiliar with the term deep poverty, just sort of think of the poorest of the poor. So the poorest of folks with low income. Next slide, please. Thanks, Denise. Poverty dashboard and brief series 3 This includes information on the social vulnerability index, 3-4-50 chronic diseases and socioeconomic status, health conditions in low-income areas, and then health outcomes and how they look in terms of socioeconomic status. So if you were just looking at a certain area of the county, like a census tract with low income or has persistent poverty, you can see what the health conditions look like in that particular area of the county using this tool. For those that are just dashboard averse and are just like, that's too much technology for me, I can't touch it. Remember, these each have an accompanying dashboard, so or accompanying brief, so you can access the brief and look at the highlights of the dashboards. Next slide, please. Adverse childhood experiences. Adverse childhood experiences are potentially traumatic experiences that occur before the age of 18, and then current research indicates that experiencing a higher number of adverse childhood experiences, or ACEs, is associated with chronic health conditions, mental illness, and health risk behaviors. The interactive ACEs Tableau dashboards that we have available help to visualize demographic and health outcome data disaggregated by ACE scores. Currently, ACEs are measured through a variety of surveys. The data provided in the ACEs dashboard series are from the National Survey of Children's Health and the Behavioral Risk Factor Surveillance System, or BRFIS. The BRFIS data is retrospective survey data of adults, so asking adults like about adverse childhood experiences in childhood. And then the National Survey of Children's Health data is at the state level. They don't have anything lower than the state level, so you can look at ACEs for children at California at the state level. Next slide, please. Our racial equity dashboards, these interactive Tableau dashboards help to visualize demographic data, social determinants of health, and health outcomes disaggregated by race, ethnicity, or race and ethnicity, depending on how race and ethnicity data is collected. Individual dashboards can be downloaded as images, PDFs, or PowerPoint slides. So if you're just focused on looking at discrepancies between or health disparities via race, ethnicity, this would be your go-to product. And you can see there on the right in the screenshot, there's demographic data, social determinants data. So if you were just interested in something like school enrollment, dropout percentage, or food insecurity, this would be the dashboard for you. Next slide. Our LGBTQ health and well-being dashboard, interactive dashboard, helps to visualize demographic, health outcome, and healthcare access data disaggregated by sexual orientation and gender identity. You may see on the dashboards, one of them, our adolescent dashboard is LGBTQ, but our adult dashboard is LGBTQ because for the adult data, we didn't have enough transgender data that was viable that we could put in the dashboard, but for our adolescent data, we did have enough transgender data. So that's why the two dashboards will have a different acronym, in case folks were wondering. I get that question a lot too. Next slide, please. Persons experiencing homelessness. This dashboard visualizes hospital discharge and emergency department discharge data for individuals with Z codes for at discharge for homelessness in their discharge record. It describes demographics, hospital data, and primary diagnoses, and is updated yearly. Our new update for this should be coming soon as we get the state data for our emergency department and hospitalization discharges from 2022. That state data should be arriving soon. And then you can see there on the right, just a snapshot of the dashboard. And it gives you an idea. So if you're looking there at sort of the top left of the dashboard, you might be asking yourself, like, why is there two large numbers there, the 4,800 and then the 8,600? So the 4,800 would be number of individuals experiencing homelessness discharged from the hospital. So basically unduplicated discharges. And then to the right of that, the 8,655, that is the total number of discharges. And then you can see in 2021 for hospitalization, it was nearly 2 discharges or 2 visits per individual experiencing homelessness. So the same individual coming and being discharged from the hospital. Next slide, please. Socioeconomic status dashboard series and economic hardship index maps. Next slide. That's just an overview of all the products. Self-sufficiency standard dashboard. This dashboard is an interactive tool that helps to visualize the minimum wage required for self-sufficiency based on the average amount spent on necessities in each health and human services agency, region, sub-regional area, and San Diego County overall. And you can see there on the left, you can toggle on this dashboard and see, like, for a single adult household, household with 2 adults, single parent household with 2 children, or a household with 2 adults and 2 children, and you're able to kind of you're able to filter it and look at different parts of the county. So if you, in the example here, you can see it's looking at Alpine versus San Diego County, but you can look at different areas of the county and see what the self-sufficiency standard says that you would need to make in order to be self-sufficient. Next slide. And then this is a similar tool, but for our older adult residents, so cost of living for older adults. Again, this interactive tool helps to highlight the economic issues faced by the aging population in San Diego County. This tool helps determine the basic cost of living for older adults. And you can see here, again, you can toggle between older adult couple, single older adult, and then owner occupied household versus renter occupied household. Next slide. Economic hardship index. The economic hardship index by Census Tract contains a map of the distribution of economic hardship index across census tracts in San Diego County. And the dashboard provides data for each of the components of the economic hardship index. And we also have a sub-regional area map for this. So if you wanted to see what the EHI looked like at a larger level, so some of the tracks aggregated together, you can look at that map and the fact sheet that accompanies it. Next slide. Socioeconomic disparities dashboard. This dashboard displays interactive maps of qualified census tracts, percentage of the population under 200% of the federal poverty level by census tract, and difficult development areas by zip code, tabulation area, and then health equity zip codes. Next slide. Our tribal briefing dashboard. The tribal briefing dashboard provide an overview of behavioral health, communicable disease, non-communicable chronic disease, injury, and maternal and child health outcomes for non-Hispanic, Native American, Alaska Native population in San Diego County from 2016 to 2020. So it's a roll-up of those data years. And then we have this, it's all put together in a nice brief. So if you are interested in looking at data, health data, and demographic data for our Native American, Alaskan Native population, this would be the go-to product. Next slide, please. And then just a couple of coming soon products. Next slide. I had touched on this a little bit, but our Health Equity Brief Series, this product's going to replace our huge 80+ page reports, be more succinct product, receiving updates every other year, and then current reports published March 2022. So update and transformation into briefs will occur this year in 2024. So we'll have new versions of these. They'll be shorter, probably about 30 some odd pages, and then an accompanying dashboard for folks to utilize. Next slide, please. And then our multiple race brief and dashboard, health outcomes data broken out by multiple race subgroup, a 3-year roll-up of data, and first iteration will be available in early 2024. Data and briefs to be updated every 2 years. This is we added the multiple race brief as well as our already published Asian brief and dashboard and Native Hawaiian Pacific Islander brief and dashboard. Because there was so much interest in the community to see health data for those communities. We had to roll up the data using a 3-year roll-up of years, but I think the products came out really well, and there was a lot, like I said, a lot of interest from our community partners. So having those briefs and dashboards updated every 2 years and available to folks, I think has been a nice addition. And next slide, I think that is it for me. And I wanted to just ask if anyone had any questions. I really appreciate you giving me the time to present.
Christopher, thank you so much. Thanks for making the time for us today. I did see a question come through, although I don't know if it's one that you can answer. It might be one for the collaborative and the community at large, which was something that you mentioned earlier in the presentation around San Diego and having cancer as the leading cause of mortality. And the question, I think, was why do we think that that is the case?
Well, similarly, like our, I mean, you saw when I was going through the presentation, our life expectancies are higher, our chronic disease numbers are going down, and heart disease is not number one here, it's number two. And I would attribute at least some of that to our active, you can have a more active lifestyle here via the weather. And then obviously, like, you know, and I'm not looking at the numbers, so this is just off the top of my head. I would also refer to, you know, we have quite a bit of sunshine here, and it's a lot, you know, you're going to be more susceptible to the sun here than you are in other parts of the country. But again, like it's not the entire answer, but our active community and our the active lifestyles of folks living here is gonna probably push that heart disease down a little bit.
Thank you so much for sharing that. And if anything comes up, Christopher, we have this presentation and your contact information. So Emily will package all of this together and share it with the partners today and anybody who wasn't able to attend. So if something comes through, we'll either reach out to you or somebody may directly reach out.
Yeah, and I just similarly to the Justice Involved question, if there's data that you're interested in and you're not finding it on our website or you're not seeing it, just please don't hesitate to reach out, and I can let you know whether it does exist on a different county website. Some of our partners, like for example, like Maternal Child Family Health Services, they have some data on their website in terms of births. If you're interested in birth data, they have that. And then our partners over at epidemiology and immunization, they also have data posted on their website as well. So even if I don't have it on our website, I can still help you try to find what you're looking for.
Thank you so much for that. I really appreciate it. You're welcome to stay on and participate in our activity today. You're also welcome to drop if you want to repurpose the time for other work. We get it, it's Friday. So, so we'll get into the activity for today and we'll talk a little bit more on the best practices playbook. So I'm going to hand things over to Ryan now to kick things off. But just as a refresher, folks, in December, we did a start, stop, continue exercise. So sticking with the trend of keeping us moving forward with highlighting best practices and advancing that best practice playbook. So I'll hand things over to you, Ryan.
Thank you. So I just dropped the link for the current version of the playbook is in the chat, so folks can have it there. So what we want to do, Emily, if you want to go to the next slide, for this next few minutes is, you know, we want to have some more in-depth conversations around this version of the playbook. And so these are kind of some questions that are going to drive the discussions, but we certainly, you know, these are just a starting point. But thinking about it in general is what do we like about the playbook, what's missing as you're looking through it, or are there practices that are in the playbook that you would agree with? Are there any that maybe you think that needs to be refined before we call it a best practice? And then also in an effort to really keep this moving, we want to talk about if you find a best practice in there, then would you be willing to test it out at your agency? And if so, then we can kind of walk through that process individually around how we can track outcomes from that, and you know, so that we can refine the information that we have, just to give a little bit more strength to what's included in the playbook. And so the goal really is for this to be a useful resource for CPI participants, but also just providers in general for those who are serving Medi-Cal members. So yeah, we're gonna spend, maybe 20, 30 minutes, see how it goes, in a couple of breakout rooms, and then we will come back together and maybe just share a little bit about what we've discussed, and then we'll kind of wrap it up after that. So, yeah.
Sounds great,
And
Ryan. Emily, are you all set to move us into breakout rooms?
Yep, doing it right now.
Great. Thank you, thank you.
and maybe like 20 minutes is the starting point, and then okay.
That works. Emily, for whatever reason, the poll came back up for me. I don't know if it did for anybody else, but if it did, you're free to go ahead and close that. We'll let everybody come back to the room as folks are joining. Thumbs up, thumbs down. Was that helpful? Did it feel like enough time? I'm seeing some head nods. Thanks, Julie. I think folks are starting to come back now. Most of you aren't on camera, so I'll just ask you to do in the chat, maybe thumbs up, thumbs down, or even on the side. Let us know if you felt like that was a good activity. We have about 15 minutes left. I wanted to do a share out. Maybe we can just share to a certain degree whether or not you thought that was a good exercise. And then Ryan, I don't know, does your group have a person ready to do a share out?
So I forgot to ask that question.
So did I.
So, I mean, if anyone wants to, you're welcome to. I took some notes on the side so I can hit the highlights as well. But
Yeah,
forgot to ask.
I forgot to ask too. So we're not alone in that. But yeah, do you want to do a quick share out?
Yeah, I'll do that. So yeah, we had some good discussions, and kind of so basically the way we did it was we just walked through like the best practices that were in the document, and then just talked about if anything needed to be added in addition to those. And so I think generally speaking, like no one had any concerns about the specific practices. We did have a couple of ideas around additional practices to include. So, some things around maybe JI or transportation. There was potentially a program that Blue Shield does that is focused on reducing readmission. So something to look into that maybe we can consider for future. But we did spend some time talking about kind of scripting and around outreach of the programs. And so I'm really just thinking more around like population specific messaging. So obviously the one size doesn't fit all. So I think really thinking about specifically when it comes to children's sort of the children versus adults, and how things are messaged. So those were big points as well.
Yeah, that's great. That came up in our group too. Scripting, outreach, messaging, and even to the extent of hiring. And then the other thing that came up, which I think was really good, is the best practice playbook is all together, but it might be good to know which audience is for which section. So like,
Sure.
this would really work as a process for anybody that's participating in CPIs, or this is maybe a best practice for enhanced care management providers over community supports providers, or maybe this is a best practice, but it's specific to short-term post-hospitalization and recuperative care, for example. Another thing that came up is, you know, from the managed care plan perspective, like, wouldn't it be cool if we knew top 5 claims issues that managed care plans experience? So something that maybe we could look at in different ways to kind of highlight different best practices based on claims payment, because that does come up quite frequently. Skill sets and workforce, that came up as well. Workforce development, and this is something, Ryan, that we've talked about, you know, how could we look at building this either into CalAIM, or do we want to look at a work group? But Julie brought up some really good points around, you know, thinking about skill sets and looking at, you know, different things that are available in the community. There's different things that are available across the state. And there are other statewide initiatives that are really focused on stakeholder attention to workforce and workforce development. One thing that might be really cool is to look at some of the skill set needs, or where are folks feeling that they're having a really difficult time filling a position, where have other people had some success, or even some success in training. So some things there. I have other notes as well, and we can kind of do a debrief and bring this back to the group. And we'll do just that. We'll take all of this feedback from today and we'll reshare it with the group, and we'll also work on incorporating some of those changes. I know we only have a couple of minutes. So I want to just kind of highlight a few things, mostly because we didn't get a chance to send you all a save the date. So we do have save the date, April 19th, CPI in person. That'll be our first in person of the year. I want to do a shout out to the county for hosting us. So first and foremost, thanks for hosting us in April. Really excited about doing this as an in-person. If anybody's interested in participating, we're going to be working to get a smaller group of folks together to help us shape the in-person event. We have some ideas ourselves, but we want to make sure that we're being inclusive to what you all are thinking for the in-person event. We are planning to have it be a full day. However, some of the activities are optional. So we're going to make some time for networking at the top and at the end of the in-person session. So you'll have the time to get into the activities, but also if you're really busy and can't make the time for a full day, we've really tried to kind of structure different sections of that to accommodate. So looking for volunteers, you can email Emily directly. We are trying to solidify those by 2/28 so that we can get the group working through March. We also are going to be working on CalAIM Academy sessions for the year. So more information coming your way on CalAIM Academy. If you have any ideas for curriculum, feel free to send them our way as well. We are trying to expand our curriculum from last year. So that's happening as well. Office hours. Go ahead, Ryan.
I'm sorry. I was just going to say, I wanted to point out to folks that in the chat, Emily just put like a registration. So if you want to pre-register for the in-person, you can go ahead and check that off your list right now.
Awesome. Thanks so much for that. Heather, I see your message here. Can we follow up offline? That would be awesome. Okay,
Yes.
I know I think there's one more slide. Test of change is here and it's at the end. I'm not, that's okay. You can go to the next slide. We are working on test of change. We have been for the year of 2023, but we haven't boxed them into a more structured QI or quality oh my goodness, my brain. We haven't boxed them into a specific format and or tool. We're going to be working on some different tests of change in a PDSA format. Again, we talked about it last year, plan, do, study, act. But we have one running right now, a PDSA, and we're going to be looking at different ways that we can incorporate things like the best practice playbook and other things that we're working on in the community into that PDSA structure. Okay, one more thing before we let y'all go, and we'll talk about this in March. We are trying to make access to resources more helpful. So coming soon, we will be launching a new website. We have this information posted on our website right now, but it's difficult for folks to access resource links. If you've got really intense firewalls, it won't let you access the information in Box. So flagging that, it will have the full year event calendar. So there'll be a pretty calendar on the page. If anybody has any issues with registration and you forget which day the monthly meeting is on, etc., that will be on the calendar as well. So excited to kind of move that forward in March, and hopefully that makes access to resources a little easier for you all as well. Brian, Emily, is there anything else that I'm forgetting?
No, I mean, other than, you know, for the office hours, there'll be a survey coming out soon just to get some more, or a poll, I should say, just more ideas for how we can make that time, you know, more valuable for you and as a more informal setting to have discussions around certain topics. So.
Awesome. Thanks so much for that. We have 4 minutes left. We'll stay on for the full time, but if anybody wants to take those 4 minutes and grab some coffee or take a mini break from what probably is a back-to-back meeting day, feel free. I hope you all have a great Friday, and thanks so much for participating today.
Thank you. Have a great weekend.